Necropsy steps. The purpose of necropsy is to be able to formulate a differential diagnosis based on macroscopic lesions, as well as to take relevant sample for tests which will help to confirm the diagnosis. It's necessary to make sure to have basic equipment on hand: buffer formalin solution 10%, sterile swabs and containers for bacteriological, dry swabs and containers for molecular test PCR and or biological for parasitology. The instruments normally used during necropsy are small scissors, enterotome, shears for rib cutter, tooth forceps, knife, bio-tool or scalpel. To prevent the transmission of zoonotic agents such as erysipelas, it's important to wear gloves during all stages of the necropsy. If the birds are alive, it's important to observe their behavior and gait prior to euthanasia, especially if they have history of locomotor problems. Observation of clinical signs may provide clues regarding which system to prioritize. It may also be useful to obtain blood from live birds. It's useful to obtain blood from live birds. These samples may be useful for serological, hematological, biochemical, or toxicological tests. Vein capture of the wing vein is usually done in adult birds. Cardiac puncture as a possible option in young birds. Cardiac puncture or obtaining the blood from wing vein. Euthanasia of birds can be performed by atlanto-occipital dislocation or compression of the cervical spine by non-cutting site of surgical scissor in young birds. By electrocution of heavyweight birds, older turkey, ducks, geese, by administration of CO2 in a container designed for this purpose, or by intravenous administration of barbiturates, or by intracardiac injection of air. It may be useful in some cases to weight the dead bird to determine their degree of homogeneity. A careful external examination assists body conformation, tethering, parasite, the navel or newly hatched birds. When examining the head, pay particular attention to the eyes and the conjunctiva. It is then recommended but not essential to wet the feather with a solution of soap and water to minimize airborne dust or feathers. If chlamydiosis is suspected, it's strongly suggested to do the necropsy under a biological hood or to beat the bird with disinfectant solution and wear a mask. Incise the hip with a knife and dislocate the hip joint firmly but carefully to avoid creating an artifact by rupturing the femoral head. Incise and flip. Here we make the incision to make the bird open, and we can conveniently see the organs inside. The skin over the abdomen and pectoral muscle. Examine the muscles and if necessary cut them in order to obtain access to and examine the deep pectoral muscle. Here, the size of the pectoral muscle also serves as an indicator of the bird's body condition. Open the abdominal wall with scissors and enlarge this opening to expose the liver, post-hepatic septum, and the intestine with a knife and a rib cutter. Inside the muscle, then cut the rib on one side, cut the coracoid and the clavicle, and deflect the sternum to the other side to gain full access to the entire coelomic cavity. Here, procedures speak about: firstly, we open the bird from the side to make it open and cut here, open on one side to see what's inside. Examine the precardial sac and the air sac, which should normally be completely transparent. If this is not the case, incise and aseptically swab their content. Take a section of air sac and put it into a cassette for fixation informally. Examine the heart in situ, then remove it, open and examine the various cardiac chambers and finally put it in formally. Examine the lungs. They should normally be salmon pink and rather dry. Peel them carefully from the ribs. Cut along the middle line and remove them from the cavity. Take a section of the histology and if necessary for other diagnostic tests. Examine the liver, incise or tear up the post-hepatic septum. Reflect the liver and the stomach on the right side of the bird. Expose and examine the spleen. A newly hatched bird, also look at the yolk sac. Remove it carefully from the coelomic cavity so as not to break it or put it aside to examine its content. Swab aseptically the inside if necessary. Emulsify most of the yolk and then put it in formally. Examine the intestine throughout their length before opening them, except when enteritis is suspected dilated. Examine the intestine throughout their length before opening them, except when enteritis is suspected. Dilated bowel, congestion or abnormal current in the intestine are only opened at the end of the necropsy in order to avoid contamination of other organs. If there is evidence of enteritis, externalize the intestinal segment and take the section needed to be fixed in formalin or frozen as soon as possible to avoid autolytic changes and post-mortem microbial growth. Examine the kidney, basin and the quiet translucent white line over each kidney is the ureter. If this line is very visible and chalky-like in color, this indicates dehydration. Ureter dilated with urate. If there is a history of leg paralysis, especially in chicks, consider the sciatic plexus located underneath each kidney.